So today we're going to be talking about orthorexia nervosa. So orthorexia nervosa is an eating disorder that's, a lot of people haven't heard of. It's not very common, but it's definitely something that's becoming more prevalent, especially with our diet culture in today's society. So what it is it stems from an unhealthy obsession with only consuming foods that are considered to be healthy or pure. And this classification comes from each person who's suffering with this disorder. So it can vary from person to person. And a lot of people who are suffering from this disorder are able to fly under the radar, it might not be as noticed as the people around them due to our culture's health obsession and diet culture. So, experts have estimated that orthorexia occurs in approximately 7% of the general population. Unfortunately, because this disorder is so new and it's just starting to become more recognized, there is no official set of criteria for diagnosis in the DSM-5, the manual that is used to assess and diagnose disorders like this. So there's no way to know for sure exactly how many people are affected by this disorder. Based on some new research that's been going on, there are some groups of people that are at a higher risk of developing orthorexic tendencies. And some of these groups are people who are under 21 years of age. A lot of athletes are known to struggle with this disorder based on, the kind of nutrition advice that they're given by coaches. Eating disorder patients often suffer from this disorder. Health-related professionals, so medical students, are at a higher risk for this disorder than, people that are in the general population. And people who are considered to be perfectionists are another group of people who, you might be at a higher risk of developing this disorder. Some common causes that, we don't know for sure, but these seem to be what would be linked to the disorder. Right now, scientists believe that a family history of eating disorders could cause orthorexia, as well as illness in the childhood related to digestive issues, a history of past trauma, or a history of dieting. Some signs and symptoms to look out for if you think that you or people that you care about, people in your life, may be suffering from orthorexia. They're going to be obsessively checking nutrition labels and all ingredient lists. So if one of your friends at school, you notice at lunch, they might make comments such as, that's not healthy, or how many calories is in that, or that's too many calories for me, or there's too much sugar in there, or something like that. Those are comments that, could be just normal comments that a healthy person would make, or they could be comments that someone suffering from orthorexia or another eating disorder would make. Orthorexia is often, goes side by side with other eating disorders, including bulimia, anorexia, and binge eating disorder. So it can be more difficult to notice compared to those other more well-known eating disorders. Some other symptoms are eliminating multiple food groups suddenly. For example, someone might eliminate all sugar, all carbs, all dairy, all meat, etc. From their diet, and it may seem like a sudden change for them. An inability for that person to eat something that is not deemed healthy or pure, and again, that's what they deem healthy or pure, and might be different from what you think is healthy. They also will display concern with what other people are eating. They might make comments to you or the other people around them, like, I can't believe you're eating that, or I would never eat that, or that's not healthy for you. Things like that are some comments that might be made. And they also could display distress when foods that they prefer to eat are not available. And their body image distortion isn't so much about their weight, but it's more about seeing themselves as pure. Orthorexia can vary in its influence on the body. There are a lot of negative effects, but it varies from person to person. Some people who suffer from orthorexia completely cut out certain food groups. So, for example, if a person cuts out dairy, they're going to end up with calcium deficiencies because they're not consuming that calcium, and they're likely not getting it from another source. Malnutrition is a common occurrence with this disorder. They oftentimes go hand in hand because people with this disorder are not consuming enough vitamins, minerals, or other nutrients. So to treat this disorder, scientists have, they're still learning every day, but it seems right now that cognitive behavioral therapy is the best way to go and is often used with selective serotonin reuptake inhibitors, oftentimes called SSRIs. Some examples of those are fluoxetine, sertraline, and paroxetine. And, if the person's a little bit more obsessive in the nature of this disorder, they may be prescribed antipsychotic drugs, to help them out with that aspect of this disorder. There are a lot of health risks to orthorexia. This disorder often causes malnourishment, as we mentioned before. Health issues can include weight fluctuation, emotional distress, reduced concentration, trouble sleeping, constipation, dehydration, and thinning hair. So something I wanted to share with you guys, this topic is pretty sensitive for me. I wanted to get the word out there because I personally know someone who has suffered from this disorder. My roommate in college, she was a good friend of mine, and she struggled with anorexia and orthorexia, and it was really difficult for her to go through that, and for me as her good friend to see that struggle. It was difficult to convince her that, she needed to reach out for help, so I wanted to get the word out there because she didn't see these behaviors in herself, but, me and a lot of the other people in her life were able to see that what she was doing was not healthy for her, and it wasn't a good source of fuel. She was an athlete, so she needs to be eating almost constantly, fueling herself for the next practice, the next game, and that's just something that she wasn't doing, and she was suffering a lot of health issues because of it. So it's always better to ask for help before it's too late. Luckily, her story, I guess you could say, and it's a success story. She was able to find an outpatient treatment program, and she's now doing a lot better. So finally, just some things to remember as you guys leave. If you or someone you care about is struggling with orthorexia or any eating disorder, remember that someone's always there to help. You can tell a parent, a teacher, or any trusted adult. In addition, the National Eating Disorder Association provides a free 24/7 crisis text line. Just text NEDA to 741-741 to talk to a trained volunteer. And again, that's available 24/7. Just remember, recovery is possible, and keep your head up, guys.